Hi and welcome back to another video of Medic Notes. This video is on bowel sounds. Bowel sounds are thought to occur as food or fluid is pushed through the intestines. As the intestines are hollow, the sounds made echo throughout the abdomen, and are often described as sounding like water through pipes. Bowel sounds may be heard 5 to 35 times per minute in a healthy person. In this video, I will explain about 3 types of abnormal bowel sounds, such as absent, hyperactive, and tinkling bowel sounds. First we look at absent bowel sound. As the name implies, there is complete absence of bowel sounds on auscultation. How long one must listen before bowel sounds may be called absent is not clear, with times quoted anywhere from 1 to 5 minutes. The associated conditions include intestinal obstruction, paralytic ileus of any cause, such as infection, trauma, bowel obstruction, hypokalemia, vascular ischemia, or even side effect to drugs. Other less common conditions are mesenteric ischemia and pseudo-obstruction. For the general mechanism of absent bowel sound, it may be caused by obstruction of an active intestine, resulting in an inability to push food or fluid through, or by an inactive bowel that is not undergoing peristalsis. Next we look at the pathophysiology in bowel obstruction. In a mechanical obstruction due to any cause, the intestines are pushing against a fixed object. The normal oscillatory movement of food and water is not happening, as in a blocked pipe, so no sound is produced. If the obstruction continues, inflammation occurs, and if vascular supply is compromised, normal peristalsis may also stop. Next, in infection, lipopolysaccharides present on gram-negative bacteria initiate an inflammatory response in the intestinal smooth muscle layer, which then reduces smooth muscle contractility, causing an ileus. Another cause of absent bowel sound is postoperative ileus. In this condition, there is inflammation of the smooth muscle layer, which then causes a reduction in intestinal smooth muscle activity. Bacterial overgrowth occurs within the gut postoperatively, and the increased presence of bacteria and lipopolysaccharides contributes to inflammation caused by manipulation. There is suppression of synaptic circuits of the enteric plexus, which organize normal propulsion of the intestines. This suppression is caused by presynaptic inhibition of enteric motor neurons and continuous discharge of inhibitory neurons. This is a flowchart showing pathophysiology of absent bowel sound in postoperative ileus. Due to manual handling of bowel or postop bacterial growth, there may be inflammation within the bowel. This causes the presynaptic inhibition and inhibitory neuron firing, thus causing absence of peristalsis, and then no bowel sounds can be heard on auscultation. Next, hypokalemia can also cause absent bowel sound. Potassium is needed for normal polarization and repolarization of muscle cells. Hypokalemia causes a hyperpolarization of muscle cells, reducing excitability of the neurons and therefore smooth muscle activity, leading to ileus. Next, in pseudo-obstruction, there is an imbalance of autonomic innervation. This causes a functional bowel obstruction. Normal sacral parasympathetic tone is disrupted, causing an adynamic distal colon. Other studies suggest increased sympathetic tone is the cause, leading to decreased gut motility and sphincter closing. Peristalsis may be absent or impaired in these cases. That's it for absent bowel sound. The second type of abnormal sound is hyperactive bowel sound, where there are frequent, loud, gurgling, or rushing bowel sounds that sometimes may be clearly heard even without a stethoscope. This can be associated with bowel obstruction, Crohn's disease and ulcerative colitis, food hypersensitivity, gastroenteritis, and less commonly, gastrointestinal hemorrhage. For its mechanism, when obstruction is present, the bowel increases peristalsis in an attempt to overcome the blockage. Lastly, the third type of sound is the tinkling bowel sound. This is a high-pitched tinkling sound heard on auscultation of the abdomen, that is often described as like pouring water into an empty glass. It is often heard in bowel obstruction. For its mechanism, it is said to signify air or fluid accumulating and striking the bowel under pressure, akin to rain falling on a tin roof. That's all for this video. Thank you.